Honorable Permanent Secretaries, distinguished keynote speakers, dear participants. This conference has been organized virtually because of COVID-19 pandemic. The EAC countries share similar challenges related to effective delivery of health services, especially with this COVID pandemic. It's against this background that we decided to devote our third E-Health and Telemedicine workshop and conference to the theme Embracing Digital Technologies to Foster Innovations in Health Care for the Well-Being of East Africans.
East African Community Regional E-Health Ministerial Conference will deliberate on the environment for e-health policies, strategies, governance mechanisms, and institutional infrastructure, and partnerships for digital health. Second, human capacity and skills development for digital health. And third, digital technology innovation for health and interoperability that will advance e-health among and between West African Community Partner States.
E-health cannot be overemphasized at this time. The Ministry of Health has implemented e-health services. First of all, we came up with e-health policy and e-health strategy that highlights key pillars that really guide the implementation of e-health in the country.
We see e-health in a way that it will facilitate a new economic venture, a new economic platform that we have never thought about.
We need to own our solutions, the solutions that we come up with, that we adopt, taking into consideration the local conditions.
If there is any subsector in the health industry that lends a great promise in improving overall health in the region, it's the whole aspect of embracing digital health. AI health engineers will be a new course that I hope will create again a momentum towards improving digital health.
So harmonization and using of the ICT has really impacted our economy, that we did not fall totally down, and the movement of goods continued, whereby now the e-payment was embraced.
The East African community has the opportunity to use digital technologies to transform the health sector by strengthening all aspects of the health system and expediting the achievements of the UN Sustainable Development Goals for a healthy and prosperous East Africa.
And also healthcare infrastructure for e-health needed to be established and enhanced, as well as they needed to have a unique patient identifiers to be in place so that when patients move from one country to the other, then they can continue with their care.
It's the provision of this type of service on a comprehensive basis across the whole region that will have significant impact on reducing morbidity and mortality in the region.
We know that in rural areas, one of the biggest issues is the coverage, internet availability. So we are using a microserver that create a standalone kind of a network that can be used with very limited connectivity.
So embracing digital technologies will not only involve us bringing the technologies, but there are other aspects we need to look at. Critically, that came out is ensuring that we have the right environment, the policies, the infrastructure, the mindset, the attitude, and the ensuring that the systems are interlinked and interoperable.
The session that we are about to have will explore the role of government and the private sector in providing the capacity building to the health workers and improving the e-literacy in healthcare in Kenya.
We've realized that most of the hesitancy of healthcare workers embracing technology is only because they do not understand the concept of the technology itself. I have realized that, for instance, when we were doing things to do with electronic medical records, where we said we don't really want to be having papers in our clinics and losing files and not being able to trace a patient's treatment. And for cancer patients, sometimes you have as many as 20 charts over the years. And so when we showed the teams on the advantages of actually using this, we've noticed that there has been 100% uptake in those sites.
That health workers can create more resilient, or even our health system can create more resilient. They can even increase the number of the people who are trained in terms of mental, not only mental health, even other areas of health. And this, creating hubs for these nurses where they can pop in their own time and assess and have something to learn.
Why digital technology? It's portable, it's user-friendly, and it works in different settings, especially mobile phones. There is minimal setup needed to develop this, and that's why we are building around mobile phone technologies.
My name is Samuel Walisimbi. The reason why this application was made just to enhance collaboration among medical workers so that there is improvement in healthcare service delivery.
We have been able to witness a need of a technology application within the health sector, which has not been seen before, especially in the area of telemedicine. And I think this is an eye-opener for us as countries to make sure that we can be able to learn from what has been done by this team from Kenya, which is led by professors, so that we can also be able to do the same back in our countries.
First and foremost, there needs to be a strategy by the government that demonstrates what are the priorities. Do we prioritize, let's say, primary care or community health, or is the priority to implement, enterprise systems to streamline services? There has to be a strategy to guide both the donors, the implementers, and the government itself, of course.
What is the today problem? As like those sockets, each one is coming with each health care facility is using his own electronic health record. Then there is no interoperability with other systems. There is a need of synergy in the collaboration when during the development of those innovative system or electronic health record, because each one is responsible in terms of privacy and security.
And as researchers, as innovators, as scientists, our main role is to make sure that the data that we have, that we are able to we access, translates into evidence that can actually improve the lives of people.
The other area, I think, as I said, looking at how important it is to start looking at, how the continent could be more engaged, is using AI to look at early detection, early prevention. I think, if we're able to start identifying some of these ailments and disease a lot earlier, then we can start, treating some of these disease.
Let's start off with inviting Dr. Ernest Dako. Doctor, please proceed. Okay.
Good morning, good people, and greetings from very cold Cape Town, South Africa. So the bigger the challenge we have, in essence, the more innovative we must be. Given that we have the biggest challenges on the face of the planet, the question then is, are we therefore being the most innovative in the world with what we have? So it's important that we get this right. We need to get it right for COVID immediately, but more importantly, we need to get it right for overall service platform issues like universal health coverage, because that will protect us against all present and future threats.
The IGAD member states have agreed on 6 data sharing and protection principles, which are captured in this slide. And those are really guidance or guidelines that will underpin how data is shared and how data is protected within the region.
So the healthcare worker has a card, an identification card, which she taps onto her phone. She then types in her PIN, and that PIN is only stored on the card, not on the phone. And that gives her access to the application. When the mother arrives with the infant, the healthcare worker takes the mother's card, taps it onto the phone, and then the immunization history is exposed on the phone. In the clinic, we install a box, and inside that, we have our technologies. We have embedded servers, mini servers, and we have backup battery, and we have a Wi-Fi hotspot. So the system is able to look after itself for up to 12 hours on its own battery. It works off both mains and solar. it becomes a charging station for the immunization devices, and we've also made it available for the healthcare workers to actually charge their own phones.
That is good, but how does that solution, how do we get a solution out without having the donor conversation?
I think for me the highest priority is governance. If we have ministries buy into what's been done, and that kind of forces the donors to align with the ministries and provide funding to get the pilots done. Once the pilots are done, I think the adoption into the fiscal becomes a lot easier.
So health information can be a powerful tool. A paramount can only when used properly to make healthcare delivery more effective and far more efficient. And we have seen from the opening of Dr. Ernest that African countries are already using a lot, and we have seen a lot of benefits in the rollout of the HIS and the management information systems, EMR, decision support system, disease specific. We are now using telemedicine where expertise is cross-shared from multiple countries, even to local areas, case-based surveillance and mobile technologies.
I also do think that even one step further, these days, the data and the data ownership should remain where it was originally captured, and then at least when it comes to the personal health data, patients or citizens should certainly have a role in controlling that.
Hello. Let me take this opportunity to welcome you to this ministerial session, which will introduce the resolutions and the summaries of the presentations that I've done this morning and yesterday. And also this one will be followed by the ministerial dialogue with our honorable ministers from the partner states on the state of achievements in E-Health and Telemedicine. And we have also discussions with the honorable ministers from the partner states. Dr. Gitao, please take us through the summaries of the deliberations that were done since yesterday. Thank you.
Thank you very much. I want to take this opportunity to briefly share a few slides on the summary of what this conference was targeting to achieve. Was to enable East African partner states to take advantage of technology solutions, improve healthcare delivery for the benefit of all their citizens.
As the East African community, let us work together and see how best we can build capacity, internal capacity. Let us instill skills for our young people to make sure that they take full advantage of the fourth industrial revolution related technologies. Talking of the artificial intelligence, talking of robotics, the IoTs and all that.
Rwanda has about 60,000 community health workers that deliver the primary healthcare mainly, and these healthcare workers are given a mobile-based application that report incidents, what we call red alerts, and they track our under 5 and pregnant women, and this has really helped us to curb down or to drop down the maternal mortality rate, and it has helped us to improve the health status of our under 5 that could die if there's no alerts that are sent to a nearby ambulance, a nearby health facility, and to the central level for us to follow up if this urgent case has been attended to.
So as you are aware, the institution, the East African Science and Technology Commission, they signed a memorandum of understanding on behalf of the EAC Vital Wave, and to apply an enterprise architecture approach that enables and supports a comprehensive, regional digital agenda across a number of key sectors. And these initiatives will build on the progress made over the last several years in the health sector. And therefore, as the East African community, digital health is gaining momentum, and we feel it's the high time, and specifically now engaging with a number of initiatives which promote this. And we've been, from 2010, we've been, undertaking these initiatives and supporting programs. And therefore now, for the last 2 days, the conference that we've been having, and some of the issues that have been read out, you concurred with the STICO that in collaboration with the Secretariat, that in fact, and of course the partner states and others, you've come up with a number of resolutions which we fully associate ourselves with.
As the EAC bloc, we believe we should thrive towards continuous innovation in the health sector, by fully embracing digital technologies within the government, but also working closely with the private sector, the researchers, the startups, to create more value, to bring more ideas on the market in different aspects. We also have opportunity at looking at how we can streamline and facilitate cross-border access to healthcare. When some services are not available in one country, you are free to go to the next country where you can get the best healthcare in having access by doctors, by nurses to your health information.
Also, effective regional policy and the legal instrument from a cross-border exchange of data and information, including for rapid alert systems in case of outbreaks among partner states are lacking. In order to cater for the situation, the country have established several frameworks that includes the National Cybersecurity Act of 2015, a National Cybersecurity Strategy of 2018 to 2023.
We, government, has also invested enormously in infrastructure for ICT. I think Tony briefly mentioned about it. The government of Rwanda has put up a fiber optic almost in every other area of this country, Rwanda, which enables different health facilities, as mentioned by Edith, to access internet, which is a very critical component. But apart from that, from the side of the Ministry of Education, we empower every other graduate at every other level to be well conversant with the usage of ICT. I think this is a critical component that the government of Rwanda has done in strengthening the human capital for health.
The first resolution for the third E-Health Regional E-Health and Telemedicine Ministerial Conference is to urge the partner states to implement E-Health and readiness gaps identified as per the E-Health assessment done, that include governing structures, health information standards, human resource capacities, enterprise architecture, legal and regulatory framework for data sharing and security. And it's good that the ministries in the EAC have already started the implementation of this, as elaborated on by the Republic of Rwanda on terms of data sharing and cyber security on information. The sixth resolution is taken in collaboration with the East African Health Research Commission and the Secretariat, and the partner states convened the fourth EAC region, E-Health Region and Telemedicine Conference and Ministerial Conference in Nairobi, Kenya from 24th to 26th October 2023. Would like to ask adoption of this resolution before we close our ministerial session. Would like to have a proposal, and then somebody also who can second the adoption of this resolution.
I propose we adopt the resolutions.
I second adoption of resolution.
I thank you all and have a nice evening.